Welcome back to Nation's Business. In this week's episode, we follow the Minister responsible for Health and Medical Services, Honorable Dr. Antonio Lalambalavu, on his tour to the Western Interior regions of Ba and Tahbua to visit medical facilities. Accompanying the Minister was the newly appointed Assistant Minister, Honorable Penioni Ravunawa, where both leaders met with staff and members of the communities. The visit is part of the Ministry's ongoing efforts to access medical facilities and observe the work being carried out by Ministry officials, particularly in the Western Division. The Minister began his tour at the Bukuya Health Center in Ba, where he toured the facility and spoke to medical staff serving on the ground.
We are indeed honored and privileged to have our Honorable Minister together with our Honorable Assistant Minister visiting Bukuya Health Center. As you know, Bukuya Health Center serves a very remote, geographically isolated population, hard to reach communities in Bukuya. It's about 2 hours drive away from our main health center or health system. So the importance of making sure that Bukuya Health Center serves its health population quite well is very important. Having our Honorable Minister and Assistant Minister come here, it has boosted the morale of our staff, as well as his visit has marked a significant milestone in progressing our primary health care goals. We believe in universal health coverage, that's making sure no one is left behind, reaching the unreached. Honorable Minister has assured us that he would like to strengthen primary health care services in Bukuya medical area. He has also informed us that he wishes to add on additional services like a provision of oral health services, that's dental services, to our community in Bukuya. That will be very, very nice. We have also highlighted to him that there's sometimes issues with LTDs around here, leptospirosis, typhoid and dengue fever, diarrheal cases. So Honorable Minister is interested in putting up a post of a health inspector for Bukuya medical area who will be based here and would work closely with our health team to improve water, sanitation and hygiene conditions for Bukuya. We wish to strengthen our outreach capability, ensuring that we are able to go and visit all the communities at least 2 times in 1 year and offer multidisciplinary service when we go there. When we say multidisciplinary, that is provision of making sure there's a doctor there, nurse, dietitian, physiotherapist, health inspector, counseling services. They all go together, as well as midwife, who can all go as a team to one community at a time to offer their services to places which are hard to come. So if someone is unable to come from the village to the health center, we should be able to go and visit them in the village, in the settlement.
As medical officers serving in remote areas are an essential part of the healthcare system, Dr. Lalambalavu highlighted the importance of government support in providing critical services in areas where access to medical resources is limited.
So the visit is just a continuation from what the ministry is doing, especially taking up this role, the minister's role. It's a continuation of visiting the health facilities, and the plan is to visit all the health facilities. The purpose for the visit is to go and see firsthand the state of the infrastructure, talk with the staff that works in those health facilities, look at the inside and outside of the facility, especially in terms of the equipments, especially in terms of the medicines, and other essential items that are needed in a facility. And part of the visit is also to experience firsthand the probably just the experience of what our staff have to go through in terms of providing service. As you had said, in this area within the Western Division, it's we're talking about the Mba subdivision and the Tabua subdivision. For the Mba subdivision, we visited most of their facilities last year and the previous year, but now we came inland to visit their hard-to-reach facility, especially the inland, from Bukuya, Nanoko, and then now to the Tabua subdivision, which is Nangatangata, Nandrau, and now ending in Nandarivatu. So to me, traveling these roads and to visit these facilities, especially for the Tabua subdivision, I can see firsthand the challenge that they go through. Even though it is a few of the facilities as compared to other subdivisions, but they are scattered. So I take my hats off to our staff who serve in this subdivision, especially in the interior, to doing public health or primary health care. And our role through headquarters and the ministry is to ensure that the infrastructure or the facility that they work in it's in better shape, conducive to a working environment, conducive to living, and also to ensure that equipments are there, drugs, perishable consumables are also there, and so also to ensure that they have adequate running water, some form of electricity supply, and connectivity. That's the main thing. Yeah.
The Minister for Health and Medical Services, Dr. Antonio Lalambalavu, made his next visit to the Nanoko Nursing Station, Nangatangata Nursing Station, and Nandrau Nursing Station. The Minister spoke with nurses serving in all three stations, whom not only provide essential healthcare services, but also serve as a lifeline for communities that may have limited access to medical resources.
As you can see, the staff from the subdivision from this medical area are so happy to see the minister coming around, giving time to listen. At least to listen is a big thing for staff that are serving in such a difficult environment. And coming around and giving them a boost is very critical. It shows that the government and the ministry care for them and is standing beside them to be able to deliver well. Looking at the geographic location of the stations, being away from their family, it's their welfare support that is also important for them to be able to deliver what is expected of them in such a remote areas. It's good to see most of them smiling and meeting the Western Health Services maintenance team in the premises, doing renovation work. If the environment is good, then only they can deliver good service to the patients.
Nurses serve as frontline healthcare providers, essential for delivering primary healthcare and managing both communicable and non-communicable diseases, particularly in remote rural areas where access to healthcare may be limited. From administering vaccines, performing routine checkups, to offering emergency care, these nurses have always been the backbone of healthcare systems. In most cases, especially in rural and maritime areas, nurses are the first and only point of care for Fijians. Rural nurses are deeply integrated into the communities they serve. In remote areas where close-knit relationships are essential, nurses often become trusted members of the community. Their familiarity with local customs, values, and daily life allows them to connect with patients on a personal level, fostering trust and ensuring that healthcare advice is well received.
The people of Sabatu, they've been so good. They've been so welcoming, and they are like a family. I've known them for just a year now, and it's a very good experience because I did not feel alone in this area. Yes, there were some times I had to face some challenges with the communication part, but they have been very, very, very nice. So it was not an issue interacting with them because they are also educated. So it was very easy for me to go out and mingle around with them, with the community, the settlements, and we have the Turangani Koros, the Nasini Koros. They've been so helpful. It's mostly the Nasini Koros. They are our eyes and ears in their settlements and villages. So they've been a great help. This is a very big opportunity to take part in. Actually, it means a lot because this is the Minister of Health we're talking about and the Assistant Minister. So it's a huge part of my career to be interacting with them face to face because we normally see them on media and we always read about them. But it's a very big moment for Sabatu especially because this is the first time they have had a Minister of Health in our area. Approximately we have 800 population. Otherwise we have 4 villages and 4 settlements altogether, including a primary school and 2 kindergarten schools. My advice is to go out there, explore, experience and enjoy because even though I as an Indo-Fijian am part of this Itoke rural area, I find it fascinating and it's interesting to work with our Itoke family. So I'd like to advise them to just go out, experience and enjoy.
When a station is built or when we do refurbishment and do new painting on a facility, fencing, it's not for me to use, but the facility, it belongs to the community that uses it. So I'm just stressing to them, advising them, and ensuring that they understand a sense of ownership and a sense of responsibility, that they have a responsibility also to look after the facility. Should they be willing to help in terms of cleaning the compound or doing a cleaning of the facility, all the better. So those are my the points I raised to them, and I think it was well received by some of the facilities, and some they've done exactly that. They've did not wait for the staff to ask for their assistance. It was just their social responsibility that they came as a community to clean the environment, to clean the compound within the facility, and also do cleaning up of the facility inside and outside.
The ability for medical officers working in remote areas to respond quickly to health issues, especially in emergencies, helps to save lives and minimize the impact of illness in rural communities. By offering primary care, health education, and emotional support, they improve the quality of life for people living in such areas and ensure that they have access to the healthcare services they need. The visit by the Minister and Assistant Minister for Health and Medical Services was a testament to the government's role in assisting staff in hard-to-reach areas, particularly inland, to address the challenges faced by the facilities.
One of the main feedbacks is in terms of transportation. As you can experience that traveling in that terrain is challenging. Eh? So they were requesting if they can be provided some sort of a vehicle, especially the much needed vehicle that's suitable for this terrain. I support the request, and it's the onus is on the ministry to go back and see how best we can provide our staff working within this difficult environment with the support, especially in terms of transportation. The other one is to ensure that they have adequate water supply, not only adequate water supply, but adequate and clean water supply. So we have, it is not an option, but it is something that we will have to do. So we are discussing with our WASH coordinator on how best we can facilitate that. I believe the other one is just the HR issue. Like as you are aware, it's affecting the whole of Fiji, especially in the facilities, and Tawa subdivision is not spared. But for those that are working here, I visited Nanoko nursing station. Staff nurse there was working there for 9 years. So there are dedicated healthcare workers, especially in the primary public health, who have worked for a long time serving in the community. And I think going back, I'll discuss this with PS. I think they should be recognized.
The tour also marked Honorable Penioni Ravunawa's first visit as the Assistant Minister for Health and Medical Services. With a medical background and prior experience working in the region, he shared the visit provided a clear, deep understanding into the challenges faced by local healthcare workers on the ground.
Well, as we know, the goalposts for health continue to move. So we continue to work hard. We continue to try to reduce the burden of disease amongst our population. So there's a lot of challenge with HIV and AIDS, NCD, and mental health issues as well. So these are all health-related issues. And through collaboration with all stakeholders, the faith-based organization, and more awareness among our people, it's critical. And I advise all Fijians to take interest and attend awareness sessions that are happening, not only with health, but with other ministries in government. It's only when we have knowledge then we are able to make better plans. And without knowledge, like the Bible says, we perish. So that is critical, educating ourselves, share this information with our family so that we can have a healthier nation.
First of all, Happy New Year to the people of for the places that I visited today in Bukuya, the health center of Bukuya, and now Nandarivatu. which belongs to the Mba subdivision and Tabua subdivision. And just want to say to the staff that are working within these facilities, especially the health center and nursing stations, I wish you a productive 2025, and we are here to do our work, and the work is to serve the people, and the ministry, the government through the ministry will try its best to accommodate and do its part in terms of improving the infrastructure, ensuring that the medicines and consumables are there on time, ensuring that they get the remuneration that they deserve, and also ensuring that the facilities that they work in are conducible and also livable, with good running water, some form of electrical supply, electricity, and most importantly, communications and connectivity.